Hello and welcome to 72 Dragons Health. Today we had the pleasure of speaking with Ayesha Akhtar. Ayesha Akhtar is the VP of Health Equity and Education of the Epilepsy Foundation of Greater Chicago. She's also the Public Health Education and Health Promotion Section Liaison of the Human Rights Forum of the American Public Health Association, APHA. In addition, she possesses mastery in diversity and cross-cultural awareness training. After completing her bachelor degree in accounting at Loyola University, Chicago, Ayesha went on to the University of Illinois at Chicago to pursue her MPH, which focused on culturally responsive healthcare practices. Her focus is enabling communities to advance health equity, and she has over 20 years of experience advocating for public health in various settings. Welcome to this interview, Ayesha Akhtar. We are indeed honored to have you with us today.
Thank you so much. The honor is mine. I appreciate the invitation.
Ayesha Akhtar, can you please tell us about your experience with the Epilepsy Foundation of Greater Chicago, and what are some of the initiatives you are spearheading as the VP of Health Equity and Education of the Epilepsy Foundation?
Sure. I have been with the foundation since 2011. I first started as an educator. I was working part-time. And in 2016, I was promoted to full-time director of education. And so I was basically overseeing all of the public-facing seizure first aid education in about 44 counties that we served in Illinois. And in 2023, I had the opportunity to sort of rebrand our department through a health equity lens. And that's also when I was promoted to VP of that department. And so now we are looking at the same space and the demographics of people living with epilepsy, but through a health equity lens. And so some of the work that I'm doing is looking at where people live and where they have epilepsy and where are they going to get care. As we all know, in the world of public health, when people get access to care, advanced level care quicker, they have better patient outcomes. So that's some of the work that I'm spearheading right now.
Thank you for sharing. Now, in your role as Public Health Education and Health Promotion Section Liaison of the Human Rights Forum at APHA, what are some of your responsibilities and goals you are aiming to achieve?
Yes, so this is a new role to me, which I'm really excited about and to dive into more. But what I really want us to do is to center these voices from communities that are underrepresented or currently experiencing human rights violations, so that we can look at, we're looking at war, we're looking at trauma through the public health lens. Unfortunately, there is so much unrest in the world today, but often we don't look at it through a public health lens. We don't look at it through the infrastructure that's crumbling. So I believe it is our responsibility at APHA to bring these voices to light and to ensure that we have the opportunities to address all of these issues.
Wonderful. Now, could you share with us your journey of empowering communities to advance maternal and child health, as well as health equity?
So maternal health is definitely a passion of mine. Of course, being a mother, that is something that was just innate. But basically, about 12 years ago or so, I found the organization called Every Mother Counts. I got to learn a lot about the work that they were doing. They were just becoming established at that time as well. And so since that time, since about 2011, I've been a running ambassador for Every Mother Counts. You probably can see some of my racing paraphernalia behind me. But what that means is I get to be a running ambassador in different races across the world, and I get to wear the race jersey that says Every Mother Counts. And it basically helps me to raise awareness and funding for maternal health worldwide. So for that organization, I have raised over $15,000 over the last many, many years, which helps to bring programs, supplies, transportation, and education to local communities. So in February of this year, I had the honor of traveling to Tanzania for the first time on a maternal health learning tour. And I was able to learn firsthand from what the communities were doing in the country to actually reduce maternal mortality in Tanzania, whereas in the United States, as we know, maternal mortality is increasing. And so what we did through Every Mother Counts was visit the different grantees that EMC gives funding to learn about the initiatives and how they have been changing lives basically for women. And so it's that kind of work that was that basically is happening all over the world. So in the United States and then worldwide. So that's some of the work that I love to do. EMC is an organization that I volunteer for. And it's just a really great way to actually see the structural changes that are happening in maternal health.
Wonderful. Great to hear that you have experience in the US and also internationally. Now, on a different topic, you are a certified personal trainer. Please share how you incorporate physical fitness into your work in public health.
I know that probably sounds really different. I mean, especially my accounting to public health and then fitness training. That was something that was a lifelong dream, actually, in 2014, where I got my certificate. I am a person who believes in functional fitness and movement as preventative health. I believe there's a public health implication in everything we do. And so when I am working with clients, and my sweet spot of working with clients are usually women who are kind of coming back to fitness and trying to get stronger and move. And that's my favorite moment. And so just kind of empowering women, especially to move and to improve their functional training. I think that's something that I really enjoy, but I definitely believe there's a public health implication in everything we do. So it definitely extends to the personal training as well.
Yeah, I can see that. Now, how has your involvement with the APH influenced your work in public health? And what are your expectations about this year's APHA annual meeting 2024 in Minneapolis, Minnesota?
Oh, that's great. I really like, so I am a little bit new to the APHA community. I've been in public health for 20 years, but I've really recently joined. And I will tell you that I am just so happy. When Atlanta last year, it was right at the time where Gaza was invaded. And it was very difficult for me to focus at this event. I would often go to my room crying. I just felt like I had no purpose. And what was I doing? But one day I saw someone wearing the word ceasefire in their lanyard, and I thought, okay, I need to find this person, and they get me, and I understand this. And ultimately, it led me to the Human Rights Forum, to that room, and I instantly felt a connection. So what I think APHA gave me was a community, and it gave me a purpose, and it gave me this space where I could actually be exactly who I am and what I believe in public health. And so I am just looking forward to going back and finding that same community. And so I can take all of those elements of community and public health back into the work that I do.
Wonderful. Yes, APHA is a community for many different people. It's a large community.
Yes, but there is something for everyone.
That's right. Ayesha Akhtar, we appreciate you talking with us today. We enjoy learning about your experiences and perceptions of women's health and the prevention of epilepsy. I wish you well with all your upcoming endeavors and the APHA 2024 annual meeting. Thank you.
Thank you so much. Thank you. I look forward to meeting you in person.